Over the past 5 years, heart diseases have been among the leading cause of deaths in Guyana. A significant percent of the population have been diagnosed with hypertension or high blood pressure, which is a major risk factor for heart disease, the Minister of Health, Dr. Frank Anthony, said back in September 2020. But with the advent of the COVID-19 and the strain on the healthcare system, came limited availability of cardiologists to treat persons living with cardiovascular diseases. This tied the hands of persons suffering from what many Guyanese dub heart problems, as they either had to live with the disease or travel abroad for treatment. However, right on Guyana's shores, 6 major life-saving cardiac surgeries were performed over a 5-day period, presenting a glimmer of hope. This was made possible by the SINGH Hospital, a private institution. Of the 6 one-hour surgeries, 4 were off-pump beating heart bypass interventions. This was performed by a specialized visiting team from India. Explaining what this entailed is Dr. PRASHANT VAIJAYNATH.
Which means we don't put the patient on heart-lung machine. We do the anastomosis, the coronary artery bypass on beating heart by stabilizing the heart, and we don't stop the heart at all. So 4 of the 6 patients were operated, and they had an excellent outcome.
Of the 6 patients, a 16-year-old girl and a 59-year-old man also benefited from a successful mitral valve replacement. The hospital reported that none of the patients had any adverse reactions and are all recovering. The SINGH Hospital, a private medical institution, has allocated assets for a new cardiac care unit capable of performing complex cardiac surgeries to treat patients with these conditions. Dr. MADHU Singh, Chief Executive Officer CEO, said that there was critical need.
We at SINGH Hospital are extremely pleased with the outcome and the fact that we've been able to help very sick patients who have been waiting for surgery for almost 2 years, because the last cardiac surgery was done in Joshan Hospital with CHI, with Dr. Stephen. I think it was in February or March of last year. So it's like almost a year and a half. Some of these patients have been waiting for a year and a half to get relief. And 2 of the patients were actually children who had been waiting for many years.
At the Georgetown Public Hospital, many cardiac surgeries have been performed. According to the communications manager Shalon Providence, the hospital, however, put a halt on elective procedures unless it was deemed an emergency. However, she said that currently most surgeries have resumed. Cardiovascular diseases are caused by unhealthy lifestyles, such as unhealthy diet, excessive alcohol drinking, insufficient physical activity, and smoking. These unhealthy practices contribute to other diseases such as diabetes, respiratory illnesses, renal disease, and several types of cancer. According to the World Health Organization, cardiovascular diseases are the #1 cause of death globally, taking an estimated 17.9 million lives each year. Reporting for the HGP Nightly News, Amel Griffith.